Hello, I'm Dr. Frankie, Clinical Psychologist, and today we're going to talk about birth trauma, which is something that a surprising number of people experience, but it often goes unacknowledged in conversations around childbirth and parenting. In fact, research shows that up to 45% of mums report experiencing birth trauma, yet it's rarely part of the antenatal education or preparation. It's rarely screened for postpartum, and it's often not even discussed. Many of us are left feeling that as long as our babies are physically healthy, we're just supposed to get over it and move on. But that expectation overlooks a whole world of emotional and psychological experiences. So let's dive into what birth trauma is, how to know if you've experienced it, and how some of the impacts it can have on your mental health, your relationships, and your daily life. So let's clarify what birth trauma actually is. The term birth trauma is used frequently, but it's still not well defined in terms of research. Sometimes people use birth trauma and traumatic birth interchangeably, but it boils down to this. Birth trauma occurs when an individual experiences the birth process or events surrounding it in the perinatal period as distressing or disturbing. An event or events that overwhelm your nervous system's ability to cope. Trauma is a deeply personal experience, so what's traumatic for one person may not be for another. You might have been told that your birth was normal or uncomplicated, but if you felt unsafe, afraid, or unsupported, it could very well feel traumatic for you. It's your perception of what happened that counts, not necessarily what anyone else thinks. So who can experience birth trauma? When we talk about birth trauma, we often just focus on the mum, but it's really crucial to remember that birth trauma can also affect the birthing partner or anyone who has witnessed the birth. Partners, healthcare providers, or family members who felt helpless, frightened, or overwhelmed might also carry trauma from that experience. Birth trauma isn't limited to the person who's giving birth. It's a ripple effect that can touch everyone involved. How do you know if you've experienced birth trauma? How do you know if what you went through was traumatic? According to the DSM-5, trauma involves experiencing or witnessing an event that includes actual perceived threats of death, serious injury, or violence. However, trauma definitions have evolved, and many experts argue that it doesn't need to involve a physical threat. Birth trauma can disrupt our fundamental beliefs about ourselves and the world, creating a sense of before and after the event. For example, you might have felt afraid for your own life, your baby's, or felt out of control or powerless. Even if a medical professional didn't perceive a risk, you might have. Your experience, your feelings of vulnerability or fear are valid. And trauma is ultimately about your experience, and only you can decide if you felt that it was traumatic. But let's look at some common symptoms of birth trauma. Birth trauma can lead to a wide range of emotional and psychological responses. You may experience psychological distress related to the birth experience. You may feel anxiety or sadness when you think about it or when you're reminded about it in your daily life. We might experience intrusive thoughts, flashbacks, nightmares. These could relate directly to the birth or even general themes of fear and vulnerability. You might avoid places, people, or activities that remind you of the birth. For instance, some parents may avoid the hospital or even feel anxious about visiting their baby's doctor. We might experience this heightened alertness or awareness of threats, feeling overly protective of our baby or experiencing anxiety about possible dangers, even in safe situations. We might feel guilt or self-blame. A lot of parents blame themselves or wonder if they could have done something differently to prevent a different outcome. We might feel that we experience memory loss, difficulty remembering parts of the birth, especially for those that were traumatic. We might experience negative changes in self-perception and mood. You might find yourself feeling less trustful of others, having low self-worth, or questioning your ability as a parent. Birth trauma impacts can vary, so not everyone will experience all of these symptoms, but if you resonate with any of them, you're not alone. So what exactly can lead to birth trauma? It can stem from various different events or situations. Late miscarriages, stillbirths, medical complications for you or your baby, emergency C-sections, resuscitation of your infant, or any situation involving a serious medical procedure or intervention. Hemorrhaging or any physical injury during or after your delivery can all lead to feelings of birth trauma. Maybe your baby needs to go to the NICU, being born with a disability or an illness. We might experience extreme pain, feelings of being out of control, or a sense of violation. Obstetric violence, which includes situations where medical professionals perform procedures without proper consent or fail to respect you as a patient. Each of these experiences can be traumatising and have long-term effects, but trauma doesn't need to look like one specific experience. It's all about your experience of trauma and how you perceive the event. Birth trauma doesn't end with the birth itself. It often has a ripple effect. Trauma can impact many areas of life. For example, breastfeeding. Birth trauma can interfere with your ability to bond or breastfeed due to physical or emotional distress. It can create anxiety in future pregnancies. You might feel significant fear or worry about becoming pregnant again, often avoiding becoming pregnant, tocophobia, which is a fear of pregnancy, intimacy issues, or opting for an elective C-section or alternative birthing options to regain control. Relationship challenges. It's common for birth trauma to strain partnerships, even years post-birth. Trauma changes us, and those changes can affect relationships. Bonding with your baby. Trauma can affect the parent-child bond, and sometimes parents experience a sense of distance or even rejection, which can be really distressing. A sense of loss. Many parents feel a sense of loss and grief over their birth experience or the transition to parenthood that they expected. And one of the hardest parts of coping with birth trauma is that it is often downplayed by others. Many people are told, well, at least you have a happy baby. But that phrase misses the fact that the parent's mental and emotional health is important too. Birth trauma is strongly linked to mental health challenges. It increases the risk for postpartum depression by 4 to 5 times. It can also lead to postpartum anxiety, OCD, elevated stress levels, PTSD, and in some cases, postpartum psychosis. Partners who've witnessed traumatic births can also experience those same risks. It's important to recognise that birth trauma isn't something you should just be expected to get over. Healing from trauma takes time, and it's okay to seek help, whether that's from mental health professionals, a support group, or someone who's empathetic. I'm Dr. Frankie, clinical psychologist. You can find me on social media at Miracle Moon UK, or for free resources, blog and information on working with me at miraclemoon.co.uk. Check out our podcast, The NICU Space by Miracle Moon, or join our membership, The NICU Space. If any of this content resonates with you, know that you're not alone, and know that you don't have to suffer in silence. Birth trauma and NICU trauma is real, and its impact can be huge, but with the right support, healing is possible. Whether your birth experience happened days, months, or even years ago, it's never too late to seek support. Your experiences matter, and so does your healing journey. I just spent the day filming with Mind Friend. Stay tuned.